All right, let's talk today about osteopathic manipulations. I think this is one thing that, depending on where you live in the country, you may or may not be familiar with it, but we use the terms interchangeably, OMM and OMT. OMT is osteopathic manipulative therapy, and all it is a hands-on form of manipulative medicine. For oversimplification, many folks liken it to chiropractic. The chiropractors split off from the osteopaths over 100 years ago or thereabouts. And there are similarities, I should say. There are some differences, but the general approach is that the body's a container. All the structures are connected, and that dysfunction in one of the portions of the body can induce dysfunction somewhere else. So just because you have low back pain doesn't mean that you didn't fall and catch yourself on your elbow and jam your whole arm up. And if we can fix that arm, then sometimes we can restore function to the low back and reduce pain. That's just one example. And even though it's like chiropractic, we certainly do some popping and cracking if it needs to be done. But if that's not for you, there's plenty of, most of the time, most of our techniques are just gentle exercises using your body's own muscles to either put something back in place or putting your position in a body of ease that allows it to relax and essentially reset itself. Because that's also one of the kind of core principles of osteopathy, is that the body is always trying to restore itself to a point of perfect health. It's always self-healing, and if sometimes all we've got to do is put in a little stimulus and help it kind of get over the hump. So a lot of people want to know what they need osteopathy for. Why would I need OMT? And here's just a quick list of things that we like to think that are really, really agreeable to being fixed by osteopathic manipulative treatment. So low back pain, sciatica. Sciatica is a big one. Frozen shoulder, rotator cuff issues, tennis elbow, TMJ, arthritis, carpal tunnel, headaches. I see a lot of headaches, and usually people have had big-time issues going back and forth, trying a bunch of different medicines. Nothing really works, and we come in here and get some OMT and get some treatments going, and it helps a lot. Sinus issues for sure, abdominal pain, some bowel issues, bloating, discomfort, things like that. And a lot of the cool things that we definitely like about osteopathy, it's not medicine. There's almost very limited side effects. Sometimes people feel sore like they've worked out. Some people get what we call a treat-me reaction and start dripping snot or urinating a lot because we're hopefully getting restored flow and getting all these kind of impurities out and getting blood flow back to things that otherwise have just been inflamed and shut off. But one of the greatest things about all this is it's safe in pregnancy for pain and discomfort that we know ails many, many pregnant women. There is something to do about it. And it's also safe in children. And we have treatments for common conditions like ear infections and ear pain and things like that. So that's just one list. But what I think osteopathic manipulations help the most with is a lot of people just say, I feel off. They feel a tug, they pull, they feel a pull, it feels pinched, and they've had lots of studies, they've had lots of tests, and there's no name for what they've got. Maybe they've seen a doctor, maybe they've seen a specialist, and sometimes even the experts can't say, I just don't know what's going on. And I think this is stuff that's really, really agreeable to treatment with OMT. You just feel off. And what we can do is we can go in there for something that doesn't have a diagnosis, doesn't have a test, doesn't have a pill. And what we can do is we can go in there and look, and 9 times out of 10 there's something off, and we get it back, and you start feeling some better. Talk a little bit about who cannot have OMT. It's not a long list, but you should definitely ask your doctor before pursuing certain types of osteopathic manipulation or other thrust techniques from somebody like a chiropractor. If you've got bone tumors, bone infection, osteoporosis, rheumatoid arthritis, ankylosing spondylitis, Down syndrome. These are kind of the big conditions that we are limited in techniques that we can do. It doesn't mean that there can't be something to be done, but you always need to ask your doctor or the physician performing the techniques, tell them that you have these conditions in order to be safe and taken care of. So if you're interested, Google osteopath near me, Google osteopathic physician, OMT, read up on it, and hopefully there's somebody in your area, a DO doctor, that can do some of this. And as a reasonable part of your primary care, if your family physician is a DO, ask them if they do manipulations. And if they don't, you can call me, and we'll get you squared away. Okay?